Hello, my name is Trina Rose Teresa Fox, and today I'll be performing this skill video for oral medication administration. First, I'm going to verify the doctor's orders. So they have ordered 5 medication. That's going to be furosemide 20 milligrams, potassium chloride 20 MEQ, acetaminophen 500 milligrams per 15 milliliters, warfarin 5 milligrams, and docusate sodium 100 milligrams, and these are to be administered at 9 a.m. Next, I will verify the 6 rights of medication administration, which is the right patient, right medication, right time, route, dose, and documentation. And now I'll begin. Knock on the patient's door. Hello, my name is Trina. I'll be your nurse today. I'm going to close this curtain for patient privacy and hand hygiene. And can you verify your full name and date of birth as I verify with the wristband? Okay, thank you so much, Mr. Joe. That is correct. So today we're going to be administering 5 medications per the doctor's orders. Are you allergic to any medications or food or anything outside? No allergies? Okay, good. So now I will go ahead and explain to my patient the different medications we're using and what they're used for and different effects that can happen. So I do want to explain the medications to you, and I want to kind of elaborate on the difference between side effect and adverse effect. So for a side effect, that is a potential possible reaction that we kind of maybe expect to happen. It's not too serious usually. Unless it persists, then let us know. Adverse effect is going to be adverse effect is if you'll need to let us know immediately, because those can be dangerous and we need to notify your doctor as soon as possible so we can get that addressed. Okay, so for the medications, I'll start with acetaminophen. Acetaminophen 500 milligrams per 15 milliliters. That is going to be used for relieving mild to moderate pain. It's also used as a fever reducer, and it works by inhibiting the COX pathways. Some side effects of acetaminophen are going to be upset stomach and possibly some nausea. Some adverse effects are going to be blood in the urine, yellowing of the eyes, and maybe a skin rash. The next one is going to be furosemide. That is going to be 20 milligrams, and it is used as a, it relieves edema from water retention, and we would check the blood pressure prior to administering that, make sure it's within range because it can lower blood pressure. It is a loop diuretic that helps to excrete sodium, potassium, and chloride. And then some side effects of that medication are going to be headache. There's headache, dry mouth, and feeling thirsty. Some adverse effects are going to be blood in the urine or severe stomach pain. The next one is going to be potassium chloride. This one is going to be 20 MEQ, and potassium chloride helps to treat low potassium levels in the blood, which can be caused by the furosemide or diuretics. And some side effects of potassium chloride are going to be gas, nausea, and some adverse effects of potassium chloride will be mental confusion and bloody stools, or dark black stools. And then we have warfarin, which is 5 milligrams, and it is used to prevent blood clots. How it works is it inhibits the synthesis of vitamin K, which therefore reduces the blood clotting. And some side effects of warfarin are going to be easily bruised, and also bleed a lot easier as well. Some adverse effects of warfarin are going to be severe sudden back pain and excess bleeding. And then last medication is going to be docusate sodium, and that is going to be 100 milligrams. And what it does is it relieves occasional constipation, and some how it works is it loosens or softens the stool, which then makes it easier to pass. Some side effects of docusate sodium are going to be diarrhea, nausea, or vomiting, and some adverse effects is going to be adverse effects of docusate sodium. It's going to be a severe stomach pain, or if you get a rectal bleeding. And also to mention about warfarin, prior to administration, we do want to check the INR levels, make sure it's within 2.0 and 3.0. So now we will go ahead and perform any of the assessments that we need prior to medication administration. In this case, we're going to check blood pressure, make sure it's within range for the furosemide, and we will also review the lab result that was recently taken to make sure INR is within 2.0 and 3.0. And so we just check that everything looks okay. And we're going to check the patient's EHR to make sure that all the medications match, and they do. So now I will go ahead and bring all my supplies over to patient bedside, and I will again hand hygiene, put on some gloves, clean gloves, and then first we will check the medications for our third and final time prior to administration. All looks good. So now we're going to put the medications into the cup because the patient is okay with taking them all at one time. So these are the medications aside from the acetaminophen. That one will be a liquid one, which we'll do right after this. So here are these medications. Here's your cup of water. Go ahead and take that with a sip. Okay. Any questions? You're feeling okay? Okay, good. All right, now that that one is done, next we're going to administer the acetaminophen. Any questions before we proceed? Okay, so I'm going to go ahead and grab our acetaminophen, and we'll pour it into the measuring cup. I'm going to grab by the label side to make sure I don't mess up the label. And then we'll close it. So actually, prior to closing, I would use a towel and wipe along the lip of it, and then close it. Okay. And then here is the 15 milliliters, or there we go. Okay, so patient will go ahead and take this. And here's another sip of water just in case. All right, and how are you feeling? Feeling all right? Good, okay, so patient has had all their medications, everything's been verified. I'll go ahead and remove my gloves, toss it in the trash. Make sure patient's in a comfortable position with the call light next to them. And I'll hand hygiene, and I'll go ahead and document my procedure.